Arboviral encephalitis is a serious condition that affects the brain, caused by various arthropod-borne viruses transmitted by mosquitoes and ticks. Patients with this condition often experience fever, headaches, and disorientation, which can swiftly escalate to seizures, paralysis, or even coma if not promptly addressed. In severe cases, long-term neurological damage can occur, making early detection and medical intervention crucial for better outcomes. While there is no specific cure for arboviral encephalitis, treatments typically focus on relieving symptoms, providing supportive care, and in some instances, administering antiviral medication. Individuals living in or traveling to areas with high mosquito or tick populations and those with compromised immune systems are at a greater risk of contracting the disease. Here's a detailed look at the intricate aspects of arboviral encephalitis and the importance of preventative measures to protect against this potentially life-threatening illness. Symptoms and progression of arboviral encephalitis. Arboviral encephalitis encompasses a group of diseases caused by arthropod-borne viruses that can lead to inflammation of the brain. Typically, the initial symptoms are nonspecific and flu-like, including fever, headache, and malaise. As the illness progresses, severe manifestations like confusion, seizures, weakness, paralysis, and even coma can occur due to the central nervous system's involvement. The spectrum of disease is broad, with some individuals experiencing mild symptoms while others develop severe neurological dysfunction. Diagnosis often requires a combination of clinical suspicion and laboratory testing of cerebrospinal fluid and blood. Due to the vector-based transmission, primarily by mosquitoes or ticks, prevention hinges on controlling exposure to these insects and on public health strategies that monitor and curtail their populations. Diagnosis of arboviral encephalitis. Arboviral encephalitis, an inflammation of the brain caused by arthropod-borne viruses, presents diagnostic challenges due to its similar clinical presentation to other central nervous system infections. Early detection is crucial, as it can significantly impact patient outcomes. Diagnosis typically involves a combination of epidemiological clues, such as exposure to vector habitats, symptoms like fever, headache, and neurological deficits, alongside laboratory tests. These include polymerase chain reaction (PCR) to detect viral RNA, serological assays to identify specific antibodies, and sometimes imaging to assess brain inflammation. However, cross-reactivity among flaviviruses and seasonal peaks can complicate serologic interpretations, underlining the importance of using a panel of diagnostic methods. Effective diagnosis requires a rapid and multidisciplinary approach to differentiate it from other encephalitic pathogens and to implement appropriate treatments. Cause and risk factor of arboviral encephalitis. Arboviral encephalitis, characterized by inflammation of the brain, is most frequently caused by arthropod-borne viruses, which are transmitted through the bites of infected mosquitoes or ticks. These vectors often pick up viruses such as West Nile, La Crosse, or Eastern equine encephalitis when they feed on infected birds or animals. Key risk factors for contracting the disease include geographic region, with certain areas endemic for specific arboviruses, seasonality, outdoor exposure, and local vector population density. Climate change is expanding the habitat for these vectors, potentially increasing risk. Individuals with weakened immune systems are more susceptible to severe forms of the illness, highlighting the significance of protective measures such as insect repellent use, wearing long sleeves and pants, and ensuring proper window screens to reduce the risk of bites. Treatment and management of arboviral encephalitis. Treatment of arboviral encephalitis, which encompasses brain inflammations like West Nile and St. Louis encephalitis, remains supportive, as there are no specific antiviral therapies approved yet. Management is crucial to mitigate severe neurological effects and involves hospitalization, hydration, respiratory support, and prevention of secondary infections. Intravenous fluids stabilize the patient while anticonvulsants are employed to control seizures. Pain management and anti-inflammatory drugs can alleviate symptoms. Close monitoring is essential to address complications such as brain swelling rapidly. Advances like experimental antivirals and immunotherapies hold promise but are still under research. Meanwhile, mosquito control and personal protective measures remain key in reducing the risk of transmission.